Central disc protrusion is the result in your MRI report. In this video, I'm going to give you 3 exercises for central disc protrusion to provide relief and comfort for symptoms and pain associated with either an L405 central disc protrusion or an L5S1 central disc protrusion. Hey there, it's Dr. Walter Salubro. I'm a chiropractor in Vaughan, Ontario, Canada. Welcome to my channel. What this channel is about is giving you tips and strategies on how to strengthen and stabilize your back so you can bend, move, and lift normally and without limitation. Like this, you can live life normal again. So if you want these tips and strategies, go ahead and subscribe on that red subscribe button below. Tap on the notification bell. Like this, you don't miss out on my weekly new videos. As well, let me know that you subscribed. I love to respond to my subscribers. I'll personally reply right back to you when you say I subscribed in the comments below. A normal disc from the top view, the circumference of the disc is well maintained, the nucleus pulposus on the inside is well maintained, and there are no annular fiber tears. Very, very important. Disc is healthy. When there's damage to the disc, when the annular fibers are torn, the inner nucleus pulposus pushes out, and a central disc protrusion is when that bulge pushes out centrally towards the spinal canal, and it begins to narrow down the spinal canal. So it's often associated with central canal stenosis. The disc injury itself produces inflammation and is pain sensitive. It causes pain and disability. If it's a more diffuse posterior disc protrusion or disc bulge, it may go more lateral, the circumferal bulge, and can actually irritate the nerves that come out from either side as well. So that's why these disc bulges are very painful. Now, in the lumbar spine, there's no spinal cord in the lower lumbar spine segments. It's the cauda equina nerves, which emerge from the L2 area of the lumbar area. So you're not going to see a spinal cord like this. But when that disc protrusion becomes more moderate or more severe, it can compress on those cauda equina nerves and cause more serious problems like neurologic deficit to the bladder, or bilateral leg pain, or numbness in the saddle area of the buttocks or inner thighs, shooting pain down both legs. That's bilateral leg pain. So these exercises may help relieve some of that pain and discomfort by opening up that canal and relieving that pressure from that central disc protrusion. So there's 3 exercises that I'm going to show you, and let's get right into the exercises. I'm going to demonstrate them and follow along as I describe how to do the exercise. Exercise number 1. This is an extension Mackenzie protocol exercise. Helps relieve pressure in the lumbar discs. You lie flat and you lift your body, your chest off the ground. Keep your elbows flat though. Do not lift your elbows up. This is the easier version. Helps relieve pressure by gapping up the spaces between the vertebrae where the discs are. This is the more challenging version, more advanced version. It's an extension exercise. Helps relieve pressure in the lower lumbar region. You extend your arms out to get a better, bigger extension. Exercise number 2. This is a standing version of the low back extension exercise that you just saw. You place your hands in front of your thighs as you're standing, and you're going to extend backwards as you're seeing here in the video. And you can do this for 10 repetitions. Hold the extension for about 1 second. Make sure you don't go into any pain range. You should feel comfortable. And you're going to repeat that 10 times. If this 10 times is too difficult, start with 3 or 4 and then work up to 10. And if 10 feels good, then you can do even 20 or 30, always within your tolerance. Very, very important. So you do repetitions of these extensions in a standing position. This gives you a variation in case you can't get on the ground, the floor, if you're at work or a different location, or if you're driving and you need to pull up in a parking lot to rest and do some extension exercises. It can be done in a variety of different places where you can't get on the floor. So it's a great alternative. The next thing you can do is place your thumbs right behind the lower part of your back and push forward, get a bit of compression and distraction in there as you extend backwards, and hold it for 10 seconds or longer if necessary. Exercise number 3, it's a lateral motion or lateral bending exercise. This can be done for a central disc protrusion, both sides, right and left, if there is no leg pain. So if there is leg pain, so let's say there's left-sided leg pain, there could be also a lateral irritation of that disc on the nerve on the left side, then you want to bend to the right side. You hold the bending for 1 second and repeat it up to 10 repetitions. If there is no left-sided or right-sided leg pain, then you can do bilateral, both sides, okay? But you start with one side, opposite to any leg pain. So on here, you're seeing the right side. Hold it for 1 second every repetition and repeat up to 10 times. If it's comfortable, you can go up to 20 and eventually up to 30 times to your tolerance. Very good to open up that lateral aspect if necessary. Now over here, what I'm showing is they can also hold the position for an extended amount of time, 10 seconds or longer. Okay, so it's a second variation. Now you'll see the opposite. So now bending to the left side, if there is right-sided leg pain. Again, if there is no leg pain, right or left, then you can do both sides together. But if you do have one-sided leg pain, then you do the opposite, okay? So hope that's clear. So bending to the left side, slide the hand down the thigh, and hold that for 1 second, and do that repetitively and rhythmically. Good motion and good gapping of the disc, and taking pressure off any nerves on the opposite side. As well, you can hold that for 10 seconds in the same direction, like you saw before, sustained hold, and 10 seconds is a start. You can work up longer if necessary. And I'm back. So when can you do these exercises? They can be done once in the morning or once in the evening, or in the morning and in the evening. It's your choice. Always do them within your tolerance. Never do an exercise that causes more pain or triggers more pain. And it may be advisable to get cleared by your doctor who assessed your spine. Now with these exercises, you may also want to look at stabilizing the core muscles. Once you get relief of pain, you want to get your back stronger and your core stronger. So I have a great exercise sequence for strengthening the core and the back. Go right here to this video right here to get these 7 exercises for the core. Great for low back and disc bulge conditions. As well, remember to subscribe on the button below by clicking subscribe. Tap that like button and comment below. Let me know what you thought about this video.